Black and Hispanic men. It's part of a new ad campaign designed to create a shift in the cultural conversation that may cause some people in need of support to not seek it out. The campaign is called Love Your Mind. And here to talk about why and why now, I'm joined by Dr. William Smith, the Chief Executive Administrator of the Huntsman Mental Health Institute, and Heidi, author who leads the Ad Council's mental health and racial justice efforts as its Chief Campaign Development Officer. Good morning to you both.
Hello.
Dr. Smith, you've had your own mental health struggles and have coined the term and documented the racial battle fatigue minorities often feel in what you call microaggressions or small or slightly vague acts of bias. Those kinds of things have been affecting communities of color for years. So why this message right now?
Well, it's important to know that people of all racial backgrounds, all gender identities struggle with mental health issues. We all are dealing with stresses in our life, and particularly around racial microaggressions that are targeted towards communities of color. There's an additional burden that they carry. So given that, we want to make sure that we capture that group of people as well as the general population around this campaign.
Okay. Heidi, some 70 million Americans who are likely to experience mental health challenges are also holding attitudes and beliefs that may discourage them from seeking help. In the Hispanic community, that may be a belief in machismo, an aggressive masculine pride. So how did you try and craft these messages in this campaign to kind of cut through that?
It was important for us to spend time doing research, and by research I mean listening to our target audience, understanding where they were vis-a-vis their own mental health, what was standing in the way of people feeling comfortable talking about their mental health. So the Love Your Mind campaign idea is really centered around this notion of reframing mental health as kind of your greatest asset for success in life, and fighting against that notion that talking about mental health, asking for help, and seeking help is viewed as a sign of weakness. We're reframing that to really say it's a sign of strength. It's so important for you to love your mind and love yourself the way you do other people in your world.
Alrighty, Dr. Smith, this campaign is, as we've been talking about, called Love, Your Mind, as if one's mind is kind of signing off on a letter to the rest of your body. But it can also be read or heard as love your mind, love it enough to take care of it. Why should especially men care enough to nurture their minds the same way they care for their closest personal relationship?
Well, in my research, it's been less about machismo and more about sacrifice. Many of these men are putting other people above their own needs. They're thinking about their family, their friends, their loved ones, and how they can help support them. But they don't do the same due diligence when it comes to their own mental health. And what we want to do is to allow people to understand that prioritizing your own health, your mental health, as well as your physical health, is not cheating anybody. You actually are investing in yourself to be the full person you could be. When you do that, then you could be a better person for others.
Just last week, U.S. Senator Alex Padilla from right here in California formed his chamber's first mental health caucus with a goal of destigmatizing, finding treatment and solutions. And this week, there's this new ad campaign launching. Is the dam starting to break? Are we starting to have less shame about all of this as a culture, Heidi?
Yes, I think what you're starting to see is progress, but we also have to acknowledge there's still a lot of work to be done. There's more open dialogue and conversation and coverage of mental health, but our research showed that over 40% of people don't feel comfortable even reaching out and talking to family and friends about how they're doing. So I think it's wonderful that so many of these initiatives are underway, and I think it's an acknowledgement of the crisis that we're in and lots of passion around helping to solve it.
Dr. Smith, wives, mothers, sisters across this country have a tough time getting the men in their lives to go to the doctor when they're actually in physical pain or distress. What words would you give them to try and encourage a loved one to reach out for mental health help? Because everybody's worried that if they say something, their honey, their brother, their friend is going to think they're calling them crazy.
Oh, no, we don't want to send that message. What we want to do is to support people to prioritize their needs, to know that I appreciate you showing up for me. I appreciate your sacrifices. I appreciate the weight that you carry, but you can't do that for us if you don't take care of yourself. So we need fathers, husbands, partners, brothers, uncles, grandfathers to prioritize their need. And then they could be healthy and happier.
And that is what everybody wants in general. Both of you, thank you so much for joining us today. And we want to let everybody know that there is a new website that went live today, loveyourmindtoday.org, where there are free resources where people can tap into some extra help, as well as seeing these ads on television and everywhere else, and being able to kind of get in touch with what may be going on in their own lives. We appreciate your insight this morning.
Thank you.